your point, certainly more interesting, and I think probably more convincing to a lot of people.
Thanks. They absolutely validated Matthias Desmet's hypothesis. I mean, you couldn't have asked for more. And it was a perfect storm. Sorry, that's overused for the media. They have blown it so badly in this case. But
now,
Laura, I wanted to also give a shout out for your messaging and your plan. I really like the point that you're talking about bringing people together and giving a message of hope. I'm reminded of Ronald Reagan, and I just wanted to give you a shout out of encouragement on that. I'm really grateful to hear you talking like that.
Well, thank you. We have such an incredible country. We have amazing people. We have people with an incredible work ethic if government doesn't get in the way and try to, replace that work ethic with something that's obviously extremely damaging, which is permanent government promises of so-called assistance, which ends up just screwing everything up. So, but I appreciate that.
In the current situation, inserting themselves into the family by mandating vaccines for children. This is absolutely wrong.
Well, Dr. Malone, I have family in California, and they're just horrified at what's happening to their friends' kids, their grandkids, in the schools in California for a virus that is overwhelmingly well tolerated by children to threaten them with perhaps pulling them out of school altogether. I mean, it doesn't seem like the United States of America, not to me.
So this is part of what's driving the migration from California into places like Texas, Florida, and I've been in Puerto Rico a couple times the last couple of months. It's full of expat Silicon Valley families that don't want to have their kids jabbed.
Dr. Malone, there are members of Congress who believe that what the social media companies are doing to censor people like you, it's good, but it's not enough. Watch.
It's no secret that our social media companies have been part of their algorithms promoting disinformation. And I think that these steps are important, but frankly, a little too little and a little too late.
Dr. Malone, where is the country going when an elected official seems to be celebrating the silencing of other Americans?
Well, I think you said it. There's going to be a big turnaround at the midterm. And where the country is going is where Joe Rogan just went, from Twitter to Getter. He's now got over 8 million followers on Getter. I mean, what media doesn't understand is that you can't suppress information. It'll find a way to be free. And we're having this is an example of the positive aspect of American economy and innovation, is that we've had all this suppression, and yet we persist, and all of these new codes are popping up and are rapidly growing because people don't tolerate this type of censorship and propaganda that is being pushed on us.
Now, Dr. Malone, I have to ask you about the masking issue that has been subject on this show since May of 2020. I was one of the few at the time who cited actual CDC studies on influenza transmission in cloth masks, over-the-counter masks. It was on the CDC website. You know the exact one I was talking about. But we had guests that came on the show that just cited that study that were basically warned by employers not to cite it. And now we have Dr. Fauci still clinging to this myth that somehow cloth masks work against COVID. Watch this.
Are cotton and surgical masks effective at preventing the spread of Omicron?
Yeah. When the CDC says they are effective, in fact, they are.
Dr. Malone, that's a lie. Is that not true?
Yes, it's Tony. What can I say? Tony has no integrity. He lies all the time. And me and my peers have been watching this for decades. We just shrug our shoulders and shake our heads and say it's Fauci.
Now, an N95 mask that's tightly fitted to the surgeon's face or the health provider's face, a very tightly fitted mask, that can prevent transmission of viruses, correct? But who can wear a tightly fitted medical-grade mask? Certainly not a 2-year-old on a flight, correct?
Yes, and